Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to the Going Deep segment brought to you by CO2 Lift. In our Expert on the Microphone series, today we're joined by Dr. Kamakshi Zeidler. She's a board-certified plastic surgeon and founder of Aesthetx, the premier plastic surgery and dermatology practice in Silicon Valley, California. In her early medical career, Dr. Zeidler personally witnessed many women in her family, from aunts to cousins to even her sisters, struggle with the effects of the BRCA gene mutation and breast cancer, giving her a motivation to seek out additional training for breast aesthetic and reconstructive surgery. Today, she's an expert in the field, and she excels in sophisticated procedures like revision cosmetic surgery, making her renowned not only in the heart of Silicon Valley, but around the world. Today, she's going to join me to break down everything there is to know about breast implants, from sizing to placement to surgical technique. With Kylie Jenner recently divulging the details of her breast implants, she's got the internet talking, and Dr. Z is going to weigh in right now with her expert opinion. Welcome to the show, superstar.
Thank you for having me.
Okay, let's dive right in, and welcome back. We love having our experts on the microphone contribute regularly, so thank you for coming on.
Absolutely.
So after an inquiring fan posted a TikTok about Kylie Jenner's flattering boob job, Kylie casually replied, coming clean with the specifics: 445cc, moderate profile, half under the muscle, silicone, and even naming her surgeon, Garth Fisher. Naturally, this sparked discussions about both implant sizing and surgical technique. So I'd love to get your thoughts on this. Let's start with sizing. 445cc is generally considered a larger implant, especially for someone with a smaller frame like hers. And some plastic surgeons have shared their thoughts online, calling Jenner's implants too big. So when it comes to choosing the right implant size, how do you help patients find what's best for their body versus what's trending online? I mean, in today's age, is still a common misconception that bigger is always better? Or do you find that proportion is becoming the priority?
I think you're really hitting the nail on the head saying that proportion is really where we're going for. Rewinding a little bit, the reason why women get breast augmentation is to feel confident in their bodies, right? That's really the ultimate goal, not to look a certain way in a photo. And so hitting it right is really about getting the patient to the aesthetic that they want. Of course, as doctors, we're here to make sure they do that safely, right? And get really long lasting results. So there's a lot that goes into picking the right implant. And I think that most of us as surgeons have our own methods. For me and many of my colleagues, we do have patients bring in inspiration photos. And a lot of people do bring in photos of Kylie Jenner. And there are people who, bring in different photos. And what it's doing is it's patients doing their homework to kind of come up with the aesthetic that they really feel is right for them. It doesn't necessarily mean that they know this is the exact implant and style and profile and the way the surgery needs to be done, because everyone's anatomy is different. So, but back to that fact, a celebrity who has a well-known body and an aesthetic, is a great way for patients to be able to understand and communicate what they want.
Now let's chat about both placement and surgical techniques. So I'm going to pivot back to Kylie. So Kylie shared that her implants were inserted half under the muscle. So can you break down what this means and how it compares to other placement options? And in general, what surgical techniques you're seeing as the most popular or in demand right now?
Yeah, absolutely. So I think implants can be placed over the muscle, under the muscle, or this part under the muscle, which we call a dual plane. Dual plane meaning, two things, a little bit of this, a little bit of that. And dual plane basically means that you lift the muscle up a little bit to get a little bit of lift. So when you lift the muscle up and allow it to window shade up, it actually pulls the breast tissue up. So it's a way of doing a little bit of an internal lift. If the breast tissue is a little bit loose and a patient doesn't want to get a full surgical lift with scars on the breast. And that's what that part under the muscle means.
Wow. All right. I didn't even know. See, I learned something new every day on this show. I love it. Now, at the end of the day, a lot of aesthetic surgery trends and beauty standards are driven by celebrities. But as we know, plastic surgery is never a one size fits all. So with so many celebrities and influencers sharing their implant details publicly and coming in with those photos, how do you guide patients towards an implant that fits their anatomy and lifestyle rather than chasing after exactly what their favorite star has had done.
Right. Again, I think it's reframing. The photos are really excellent to communicate a look. Like as surgeons, I can look at someone's body. I know what the surgery can do, but a patient may not. And so the photos help us communicate. That being said, when you come in for a consultation, you really need to look at your anatomy, measure the width of your chest. Implants that sit too wide can give like too much side boob or too much cleavage. Sometimes patients call it credit card cleavage where the breasts are always touching. And sometimes that's not the desired look. Sometimes it is. So when I'm having a consultation with patients, I'm looking at the anatomy and saying, for the look that you want, this is the implant that can work. This is the anatomy you have. Trends definitely change over time, but again, with that under over the muscle issue, what we're seeing much more is a new generation of implants, the Motiva Smooth Silk surface that does not create capsular contracture. It's one that can be more safely placed above the muscle without fear of capsular contracture. And then the filling of the silicone gel and implants now, even in next generation's saline implant, they're such that patients don't get lots of visibility and rippling. So again, there's lots of techniques, lots of anatomies, ways to get great results, but the trend is definitely towards a less invasive and a more preservative approach over the muscle.
Great information. Now, the silicone versus saline debate has been ongoing for years, but in recent years, in recent conversations, we're hearing more buzz around newer options, like you just mentioned, the Motiva implants, which many patients are gravitating towards because of its natural feel and movement. Do you find your patients today to be more concerned with how their implants look or how they feel, or a balance of both? And how does Motiva fit into all of this?
Absolutely. I think it's a balance of both. I think as surgeons, and we are seeing patients more in movement when people are looking at before and after results. We have Instagram now, and then the video component of this is significant. What looks good in just a static before and after is not enough. The way that people look in motion when it comes to exercise, when it comes to intimacy, breasts move, and the way that they look when they move is a big part of things. And that does go similarly to the way that they feel, and the feel, I think, is twofold: the actual feel of the implants and the softness of them, but also where they're placed in the body is how they feel, the mind body connection of implants. I think a lot, I definitely favor above the muscle, just because breasts are not under your muscles. And so the feeling of movement when you're exercising, when you're enjoying your body with intimacy, it's important. And so I think that equal balance of both.
Now, again, with more celebrities pulling back the curtain on their surgeries instead of the secrecy and denial of the past, do you find that the added level of transparency is helping patients ask better and healthier questions, or have you seen an impact on patient beauty standards and expectations?
I think the transparency is amazing, and I'm all for it. I'm really grateful that, some celebrities have led the way. And I think, yes, Kylie shared hers, and then people are sharing their thing. And what it does is it brings up the conversation around there's many different ways that great results can be achieved. And I think it takes away some of the stigma. I mean, breast aesthetics in particular has been clouded with so much stigma outside of all of the medical components to concerns around safety and longevity. But the desire to enhance your body a certain way has been something that a lot of women feel that they need to keep a secret. And then we see the transparency is transcending beyond breast aesthetics. People are talking about what they do for their face and, having facelifts and feeling confident about it. And so I've talked to some of my patients, and they say it's not that it's opening the door to this is exactly what I want, but it's more this general era of an acceptance of, doing procedures to feel confident in your own body and erasing that stigma. So I think it's wonderful.
I agree. If I had access to the information I have now when I was considering my implants 14, 15 years ago, I think I would have been at a very different place. Right. So you're right. Transparency is important. Now, before you wrap up, one last critical thing. I want to talk about age factor here. So something I found interesting is back in 2023, so 2 years ago, Kylie Jenner actually admitted to regretting augmenting her breasts at 19, even going as far as to say, I have a daughter too, and I would be heartbroken if she wanted to get her body done at 19. I wish I could be like her and do it all differently because I wouldn't touch anything, right? So with social media, influencer culture, and shifting beauty standards, a lot of plastic surgeons are seeing a younger clientele seeking treatment. I find this frightening. So, Dr. Z, when you're working with patients, okay, in their late 20s or early 20s, considering implants, how do you approach these conversations around timing, expectation, and long-term impact? And on the flip side, are you seeing more women come in for revisions or procedures they had done at a younger age?
Yeah, well, a lot to unpack there, but
Yeah.
I think anything you do when you're young, is something to, be very thoughtful of. Breast implants are certainly one, just because once implants go in the breast, there's pretty much a guarantee there's be another surgery, just because the body keeps changing. So, um, going through pregnancies is a big time that changes happen. I'm not involved in Kylie's care, but she definitely made these comments after having had pregnancies, and breasts change a lot. Some people, maybe have some regret about those changes, but oftentimes it doesn't necessarily change the way the breasts actually would have looked. And so um I really like to tell patients is you're here to enjoy your body now. If you love your body without intervention, you should do that. And if you're looking to make a change, you want to be really thoughtful and take your time, do your research. And I think this era of transparency is making it much more accessible to all patients considering procedures to understand the pluses and minuses. So yeah, at 19, having implants, placed under muscles, very aggressive surgery, lifts, maybe are things that patients regret, but having a very safe procedure with good understanding of all the options, I think can still be very empowering. I mean, in your 20s, you're enjoying your body and wearing fashion, you're traveling the world, living life, or, pursuing your dreams, and feeling confident in your body, I think is really important.
Yeah, and 19 is very different than 29, right?
It is. It's very different. Yeah.
Yeah, and you just very eloquently said that. So thank you for framing it. Well, we are at the end of our date, my dear. Thank you so much for coming on. It's always a blast having you, and I learned so much. And I now want to just come to you for like all my procedures.
You know how to find me.
That was the incredible Dr. Kamakshi Zeidler, board certified plastic surgeon and founder of Aesthetx. Definitely check out her practice online at aesthetx.com and follow her on the gram at aesthetixmd or at Dr. Zeidler. You're listening to A Moment of Zen right here on 710 WR, the voice of New York, iHeartRadio. That was the Going Deep segment, brought to you by CO2 Lift. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.